Hi everyone, I'm with a patient today and we are working on a little bit of the scientific approach of getting into tightness in the hip here. So it is science inspired, art inspired by science, and I'm masked because I'm in with patient care, but I'm going to show you a little creative way to dig into if those of you who know anatomy a little bit, it's the TFL. So if you don't know anatomy and this is tight, maybe it's your TFL. I'm going to show you how to dig into this quite literally. This is super helpful post hip arthroscopy, but if you also have long-standing hip problems, impingement, or possibly it could be a labral tear, then this may be a little bit of a relief for you. So I'm going to show it to you first, and then we'll dig in from there. You need one of these little TheraBand rollers, okay, or something that can mimic that. So you don't need it exactly. Most people use it and they just think they might roll over something like this. Well, that can feel good, but oftentimes it doesn't last. So you're going to bring, if it's your right leg you're working on, you're going to bring your left leg over. You're going to bring this all the way down into your groin, but not on the groin side, on the outside of your hip. Your left leg is going to capture it here so that you can let go with this hand. So it's like a, look mom, no hands. Okay, hands free. You're going to reach across, pick your leg up. And then now you're using the lever arm, okay, of the left leg stabilizing, and you're not going to bend your right elbow, you're going to keep it straight. You're going to cross your ankle over, your right ankle over your left, so that this right leg can be completely at ease. And you're going to press down by shrugging your shoulder down. So for those of you who do follow me with medical therapeutic yoga, this is a shoulder lock here, okay? A shoulder lock and an arm spiral. And then you're experimenting, because this is a roller. I can roll it just a little bit. And also I'm pressing the joint kind of down and out. It's called a posterior inferior glide. And a release of your TFL. While you're using really good yogic breathing, I'd like for you to imagine doing like a fish gill breath. Imagine your back ribs are fish gills. And when you breathe, the back ribs expand and open like gills. So no chest breathing, more of a back rib breath, a little bit of a belly breath. And you want to spend at least a couple of minutes doing this, okay? That is the easy part, okay? The hard part is actually trying it on yourself. It's easier said than done. So we've got our lovely patient model, thanking her for donating her body to science for just a little bit. So she's going to do the same thing. She's going to get that into the right hip. It's going to be low and towards the outside. She's going to bring the leg over and capture it. And in this case, wearing shorts, it might aggravate the back of the leg. So maybe a pair of jeans would work better, or some yoga pants or something. So she's going to use the lever arm maneuver like I showed you. Freeze up her hand to bring the right knee into the chest. Good. And then she can just easily cross that leg over, just allow it to relax. So right leg relaxes, and then she can experiment using the lever arm, using the bar to press down and do a little bit of tiny rolling over the outer edge of the leg in the TFL area. Good. So the key is, I want you to use your mindful breath, your yogic breathing, to completely relax your right leg. If you're holding your right leg, this doesn't work. You have to completely let the impacted leg, the leg you're working on, relax. You let the other leg do the support. And you let, in this case, the right arm do all the work. How does that feel?
Feeling the release a little bit.
Good. Good. So any of these things that I teach you, of course, are not a substitute for physical therapy, and it's not a cure-all. But because, for example, we just did dry needling into the scars before that, because there was a lot of like crunchiness and kind of adhesions there. So this is part of an integral program for particularly people who are post-hip scope, but it's just one of the many ways that you can help yourself out and have less pinching and less tightness on the outside of the hip. All right, until next time.